New York State has a very good education system. According to one report, it ranks 8th nationally overall, tops in per-pupil spending, 5th in university quality. But in at least one measure, New York is anything but. It's dead last in the country in helping the youngest children with developmental delays before they get to school. How we got here and why the state isn't doing much about it on today's Story of the Day.
Support for Story of the Day comes from Long Run Wealth, an SEC-registered investment advisor in Lake Placid, providing comprehensive wealth management, retirement, and financial planning solutions. LongRunWealth.com. And the Devlin Inn and Suites, Lake Placid, welcoming families, athletes, and groups to the Olympic Village, offering Adirondack mountain views and dog-friendly accommodations. TheDevlinNY.com.
Hey, I'm David Summerstein. It's Wednesday, July 30th. First up, a top New York State lawmaker says it isn't possible to raise taxes to make up for new federal cuts. Jimmy Vielkind reports for the New York Public News Network.
Assembly Speaker Carl Hastie says the state won't be able to dig out of a $7 billion deficit without doing some spending cuts. Almost half of that projected shortfall in next year's budget is the result of the federal tax and spending bill signed this month by President Trump. Hastie has previously favored taxing the rich to solve budget deficits, but he says that has limits.
Taxing ourselves to $7 billion, that's a lot to tax. That's a big amount to try to tax, so I don't know if we can do all of it.
The Bronx Democrat said he couldn't rule out cuts to Medicaid as a result of the new federal law. Lawmakers will hash out a new state budget in the first 3 months of next year. In Schenectady, I'm Jimmy Vielkind for the New York Public News Network.
New York's early intervention program serves about 70,000 kids between the ages of 0 and 3 who have developmental delays or disabilities. Or at least it's supposed to. New York's program is ranked last in the nation for the timely delivery of services. About half of the kids who are eligible for therapy don't actually get it. That has far-reaching consequences for children and the entire state education system. Amy Feiereisel reports.
In rural Washington County, there are some therapies for children that are completely unavailable. Autumn Headwell is a service coordinator for the county's early intervention department.
For example, we have no OT in southern Washington County, at all.
OT stands for occupational therapist.
So if there's a child that has sensory concerns or fine motor concerns, we can't provide them services.
Headwell says other services like speech therapy are also severely limited. And Washington County is no anomaly. It's more the standard, especially in rural areas of New York.
Any kind of shortage you have in a urban area is so much worse in a rural area.
New York's early intervention program has been in trouble for a long time. The many reasons can essentially be boiled down to pay. Early intervention therapists are treated as independent contractors, and while they're doing state work, they don't get state benefits or wages. And their hourly pay is essentially the same, even a little lower than when the program was started in the mid-1990s. Christy Bitzrutzik lives in Plattsburgh, and she's a former early intervention therapist.
We're New York State certified teachers and providers, and we can't tap into a New York State healthcare system or retirement system or a tiered pay system. We have providers starting less than what I started in 1998.
Pay has stayed stagnant over the course of several different New York governors and administrations from both sides of the aisle. But Bitzrutzik says it's pushed agencies out of business, and it's led therapists to look for jobs elsewhere, in hospitals, for insurance companies, school districts.
And when you just look side by side, it's a no-brainer. You can't blame someone for wanting to do better for their family.
But there's more than that. 2,000 therapists left during the COVID-19 pandemic. Even more have left in the past year. Last October, there was a disastrous rollout of a new state billing system, which led to many therapists going unpaid for months. Then there's the delay of a 5% rate increase, the first in decades. It was promised in last year's state budget, and it still hasn't taken effect.
So the fact that the rate increase was promised and has not come into place is incredibly discouraging. And of course, they're just leaving.
That's Bridget Hurley, a chief program officer at the Children's Agenda, a state advocacy group that's been pushing for early intervention reform.
The folks who are left providing early intervention services in New York State are heroes. It's just not a tenable employment right now.
NCPR has repeatedly asked the state about its failure to serve half of the children who are eligible for therapy. The state's Department of Health and the Office of Family and Children's Services have never directly answered the question. In emails, they say the state is, quote, committed to supporting and enhancing early intervention services, end quote. Hurley says it's unfair to New York families that this federally mandated service is not being provided.
Kids have a right to these services. They have a right to these services in a particular time frame, and those rights are being violated.
What this means is that tens of thousands of young children every year are missing the window during which therapy is most effective.
When you provide therapies to a child who's 18 months old, they have a much greater chance of making progress than if you wait until they're 5, 6, 7, 8 years old.
This leaves parents in a position of having to fight for their child's rights, and in lieu of professional help, doing a lot of detective and guesswork.
I try to do as much research as I can. Do I know it all? No. So it's like our whole downstairs looks like a Montessori school, really.
That's Kaylee Yeager. She lives in Hamlin, a town in Monroe County, about 30 minutes west of Rochester. Her son Matthew has autism, and when he was 2, he qualified for speech and occupational therapy through early intervention. He got a year of the speech, but only a month of the OT. Yeager says she wonders what gains Matthew could have made with more occupational therapy, if he would have made progress on the physical skills he struggles with.
How to hold a pencil, how to cut with scissors, how to walk up and down the steps safely.
Yeager stopped working to care for her son full-time, but she says that's not something everyone can do.
So us speaking out on this topic is also for all those parents that are working a 9 to 5 plus or just don't have the ability to advocate the way that we do.
And it shouldn't be this hard, she says. A parent shouldn't have to be chasing down federally mandated help. Yeager says the state isn't setting up its children for success and that that's a choice, to not raise pay, to not incentivize therapists to join early intervention.
New York State is in a crisis and they're breaking federal law. This is our future.
And a kid doesn't stay 2 forever. The lack of intervention compounds as they grow up. Bridget Hurley from the Children's Agenda says because kids aren't getting therapy when they're younger, they head into public school with bigger issues, which costs more money.
When you wait, it's a lot more expensive and you don't make as much progress with that child.
She says what can cost a couple $1,000s from 0 to 3 years old costs taxpayers between $14,000 and $18,000 annually on the K-12 level.
Of course, not to mention the impact on that child and the family and honestly, the community in the long term, because that child may need lots of services as an adult.
Christy Bitzrutzik, the former early intervention therapist in Plattsburgh, now works for a pediatric office helping to address developmental delays. She's also getting her PhD through Johns Hopkins University, and her dissertation is on New York's early intervention system. She believes it's no coincidence that New York ranks last in the country for delivery of early intervention therapy, and is also the highest user of special education services in the continental U.S.
So what does that tell you, though? When you kind of zoom back and you're looking at all of these kids that we could have provided early intervention services to.
She says, as anyone who's studied childhood development can tell you, it matters when you address delays.
Those numbers would decrease significantly if we were in there during those critical windows of brain development, and we're not.
She says the price of that failure will be paid by children, their families, and their communities, because in the end, the buck has to stop somewhere. Amy Feiereisel, North Country Public Radio.
This story is the latest in a bunch of stories that Amy has done on the breakdown of early intervention services in New York. And to be honest, I think she's the only journalist reporting on this issue regularly in the state. NCPR's reporters are paying attention. We're listening, finding the problems that need to be solved and bringing them to the light. But with all our federal funding cut, that work is seriously in danger. That's why we're doing an emergency fundraiser right now to raise the $670,000 that Congress clawed back. We're already about 20% of the way there, so there is hope. You can help by increasing your donation to NCPR at ncpr.org/give. Double your monthly donation, triple it if you can. Give for the first time, whatever. It's an urgent time, and we all have to come together to protect the important journalism, like Amy's story. Give now at ncpr.org/give. Thank you so much. Music today by Patricia Julian of Burlington and Dan Duggan of Lake Clear. I'm David Summerstein, North Country Public.